Hi, my name is Jackie, and I am in the MSM program. I will be doing a musculoskeletal assessment, and this is my patient, Tremaine. Tremaine, do you give me permission to video your assessment so my instructor can see it on YouTube? Yes, thank you. So first of all, we're going to start out with the hands. And so when we start out, we always do an inspection. So when I do an inspection of Tremaine's hands, I'm looking for um, any redness, any swelling. We're looking for any atrophy, muscular atrophy. We're looking for any nodules. And then also, when I go ahead, when I go ahead and assess, palpitate her hands, then I'm going to be looking at her fingers, and in the fingers, this digital right here is the proximal, and this is the distal. And so in here, we'll just palpitate a little bit, to see if there's any pain, any tenderness, and also if there's any nodules. And we do bilateral for both of them. And then also we're supposed to point out the metatarsal phalangeal. And the metatarsal phalangeal, you would take your index finger and walk down the metatarsal until you get to the head of the metatar uh, the meta the metatarsal. And when you get right here to the head, and then at the lower part, this is the head of the metatarsal, but this is the lower end of the phalangeal. And so there's like a little round right here is a concave, and that is called the metatarsal phalangeal joint. Okay, so we're gonna go on, and we're gonna have Tremaine to extend her hands, and when we extend, we open our fingers. That's adduct, and then we abduct. When we close your hands, that is abduct. Add, add, adduct. And then we open them and we close them. And then also you're going to take your hand, and it's midline right here when it's straight. And then we're going to have you turn it inward. Turn your hands inward. And that is abduction. Adduction. And this is abduction, and that's ad adduction and abduction. Okay? And then so we have you flex your wrist. So you will flex, extend, flex, extend. And that is we also examining her to see if there's any does she have any carpal tunnel. There's a few tests you could do for the carpal tunnel, and one is the tensile test. And with the tensile test, I would take her hand and I would turn it this way, and then you could just tap right in the middle between the ulnar and the radial, and you would just tap with your middle finger. And then if there was any pain or any numbness, she would feel it in her index finger and her middle finger. Any pain? And then we would go on to look at her. Let me make sure I got all my. So, Troy, let's have you make a fist. So now we'll look up the ulnar and the radial deviation in the wrist. So this is the ulnar side right here, and this is the radial side. And so what we do is we go ahead and we could test this one. And when we test this one, we can do the the Allen test. And when you do the Allen test, you'll make a fist. Put your thumb in there. Let's do this hand. You'll make a fist. And then while she's making a fist, I'm going to go ahead and press down on the ulnar and the radial. And when you open up your hand, and then it should be pale. And when I let go, the color comes back. And then we'll have you do another fist and open it. Wait, do another fist. Now open it up, and we'll do it on the radial side. And the same thing happened. When you put the pressure on there, then it turns pale, and then when you release it, then you'll get the blood flow. And then another test we're going to do, and that's the Fallon test. And with the Fallon test, you could do the praying hands this way or the reverse, wrist to wrist. And you will have the patient hold it there for like 30 seconds. And you put as much pressure there as you can. And this is another test for carpal tunnel. When she opens up her hand, then if she has any numbness, any tingling, any pain, then that's a sign of carpal tunnel. And for the metatarsal, for the metatarsal, for the metacarpal, in the metacarpal, the metacarpal is right here and this is where you can feel, and you should be able to feel the little cartridge there for the for carpal tunnel. Oh, and I forgot to mention with the Allen test, you do the Allen test when you're going to draw arterial blood or do any kind of arterial puncture. If the a test is positive, then you wouldn't do that. Okay. And the test. Oh, and I wanted to do the anatomical snuff box test. And that's when you take your thumb and hold it up. And then there's like a little groove right here. You will put pressure right in here. If you can see it. You put pressure right in here and you hold it. And if there's any pain, then that's another sign of carpal tunnel. But this area also doesn't get a whole lot of blood supply. So you could have like a, a neuro a neural fracture. Neuro. Then we're going to move on to the elbows. And with elbows, we're going to be looking for any redness. I'll have you pull your shirt down a little bit. We will be looking for any redness or swelling. Turn your arm this way. No, that's okay. No. So with the elbow, so what you're gonna do is you're gonna just be inspecting. When you're inspecting, you're looking for any swelling. You're looking for any nodules. You're looking for any pain or any deformities. So what you do is you'll take your hands and you'll do the epicondyle, which is right here and over here. So this is the lateral and this is the medial. And usually time when you patients have pain right here, it's usually golfers or tendonitis where people do different repetitious work like bending their arm and it gets really sore right there. And then we're gonna flex and extend the elbow. So we're gonna flex and extend, flex and extend. And then with the elbows, you could do the supination. The supination is this way, and then the pronation is this way. Okay. So then we're also going to look at the old cranium, old cranium, and process, and that would be bend your elbow. That would be at the tip of the elbow. So, so we're gonna do some range of motion. So I have you stand up. And while she's standing up, we're gonna have her to put her hands at her arms at her side, and then we're gonna go ahead and have her to abduct. Yeah, to okay. So we go abduct is going out. So we use this arm going out. Okay, and that's adduct. So that was part of the range of motion for the shoulder. So in looking at her shoulders, I could look at her from behind to make sure that it's symmetrical. You know, both of them are even. If one was a little bit lower than the other one, then we would have to look at a possible dislocation. And so when we're looking at the shoulder, we're looking for rotator cuff injury, dislocation, and impingement, like of a nerve. So then we're going to have so we could take your hand, Tremaine, and you can act like you scratching the back of your neck. Okay. And then you take your hand and do it the opposite way and go for your scapula on this side. And then we have you turn around. Then I'm going to take your arm, turn around, right here. Then I'm going to take your arm, and I'm going to have you to do like the cross arm, and I'm going to take and push it up and see if that's painful. If that's painful, that would be like a rotator cuff. Okay, then we'll take your arm. Then we have you. Then I'm going to and is that painful? No. Okay, then I'm going to take it and do it this way. Just keep it across you. and you're kind of putting pressure on her shoulder. And that one is like the apprehension test because if I held her elbow and it was up like this, then she should give me a facial expression of apprehension. And then we're going to look at doing, we could do the drop arm test. And with the drop arm test, she would take her arm and I'm going to have her put her arm all the way out, and then I'm going to have her to lower her arm by herself. So we're going to go here. So we'll have you drop your arm. And then if she had raised her arm and she started to lower, but it was really painful and it drops like that, that's called the drop arm. And with the drop arm, that would be a sign of rotator cuff. So then I wanted to go ahead and do palpitation of the shoulder. And this is this suprasternum notch. And as I walk it over here, if I go lateral, go this way, then there's a little notch right there, and that would be the summit of the shoulder, the summit of the shoulder. And then I move over a little bit farther, and that would be like the ulnar process right here. And this would be the AC joint, which is right here. And then if I move down, just go down toward the pectoris. Um, right in here is the coracoid. It's right in there. You could kind of feel like a little notch right there. And then we could move over a little bit more, and then this would be the lesser tubal, and this would be the greater tubal. And then if we did the deltoid substance, so when we go for the deltoid groove, this is her deltoid. So we'll go right up here, and it should be right in there. Okay, and so the flex, the Hopkins test. Okay. So with the Hopkins test, with the Hopkins test, she could be sitting or standing, and what I'll do is I'll take her elbow, I'll put it like this, and I'll start to turn her. Keep your elbow, and then I'll start to turn her. Don't just relax. I'll start to turn her shoulder, and that's how you could tell if it's a impinged nerve or a rotator cuff. And with the apprehension test, you're supposed to hold your arm up like a baseball catcher, and then as she start to bring it around, and then I would take my hand and put it on her shoulder and see if that would see if that hurts. And then for the shoulder, when you want to stand up, for the shoulder, we would do behind. No, you take your arm and put it behind you. No, just straight behind you. So this is the range of motion for the shoulder. So she will put this hand behind her, and then she would take this hand. So this one goes in front of her, and then this one goes behind her, like this. And then we're going to move on to the head and neck. Trying you can sit down. And with the head and neck, we're going to be looking at any type of deformities and abnormal posture. So what I'll have Tremaine do is take your chin and put it down to your chest, and that is flex, and then you extend it by going back to it one more time. And the next test we're gonna take, she'll take her shoulder, and She'll rotate her neck, turn her head to this shoulder, and turn her head to that shoulder. And that's like the cervical rotation. So that would affect the cervical spine. Touch your ear to the So you would take your ear. Just like if she was having pain, so she had pain on one side of her shoulder, like the left side, then I would have her to take her ear and do it to the shoulder, to her right shoulder. Did I say that? So if she had pain on her left side, then I would have her take her head and this ear and try to put it to her shoulder this way. And then if there was, you don't want to have her to do that if she's already complaining about pain, because that could be a sign of her spine having spine problems, neck problems. Then I'm gonna have you to open your mouth and close it. So open wide and close it. So I'm going to be looking for the maximal, how wide she opened her mouth. She opened it wide. And then I should be able to, when you open your mouth, I should be able to get 3 fingers vertical into her mouth. So the next one we'll do is called lateral movement. So I have you open your mouth and you're going to move your jaw from side to side. So I'm going to take my fingers, 2 fingers, and put it on the tragus of the ear. Then I have you open, close, open. And this is assessing for TMJ. So there will be some tenderness there. So the next one is we're going to be palpitating the sternal clavicle. And that would be right here. Because this is the sternum and this is the clavicle, which is the collar. And then we have the cervical spine. And with the cervical spine, it would be back here, like like number 7. And then the cervical muscles. This is the trapeze that goes down this way, and the cervical paracervical muscles would be going this way. So give me a second here. Okay. And so one other thing I need to point out is the rhomboids. And on the, if you just turn it back this way, like the trapezes go like this, and then yeah, the trapeze is like a big piece, and the triangle goes this way, and then you have the paracervicals that kind of go. No, the rhomboid goes this way, and the paracervical muscles go see, this way is trapezius, and then this way will be the paracervical, and then rhombosis is like this way. Rhombosis and the paracervical goes this way, and then the rhombosis go. It kind of like it goes up under there, but it goes like in a down motion. And then we have the Sperling test, and the Sperling test we do that for spinal stenosis, cervical stenosis. And what we do is with that test, I would have her to bring her head this way, but at first we could go laterally go back. And then if she could stand it, we'll have her to go this way, and I will add a little pressure to it. But if I add pressure and it's painful, then I wouldn't proceed anymore. And then we'll move on to inspect the feet and the toes. So you would turn that way. Turn your feet that way. And so with the feet and toes, we're going to be looking. We're going to inspect them for any swelling, any any pain, any deformities, any coins, any nodules, and we're also looking for flat feet. She doesn't have that. And then we're going to take her, we're going to flex your toes. We'll have you curl your toes and extend your toes. And then we're going to palpitate the interdigital for neuroma. And neuroma is like a nerve. So what you do is you take a foot and you squeeze it with your hands, and then if there's any pain or if there's any clicking, then that's a positive test. So we'll look at her proximal and distal interphalangeals and metatarsals. So this is her distal. This is her distals at the tip of her toes, and her proximal is right here, and these would be the distals. So we're looking in between her toes. Then and then we'll do the range of motion. So we'll do the dorsiflex and the plantar flex. So this is the dorsiflex and then the plantar flex. I don't know why I keep going to this foot. We're going to check out her ankles also. For discoloration, any swelling, any numbness, any deformities, looking for nodules and tenderness. And then we'll have her to do her flex of her ankles, and you rotate your ankles in a circle. Then we're going to move on to the knees. And so with the knees, we'll have you to lay supine on your back. So we'll be on her knees, we'll be looking for alignment. We'll be looking for swelling, any nodules. And then we're going to be feeling for her patella. And then there's like should be a notch right up under the patella where it's right here. And that is, and so the popliteal fossa is right back here, like the little dimples in the back there. And that in this part right here, in the middle part, that's where you will find the Baker's cyst. So this would be the supratellar right up here on the top. So you extend your knee straight out, and then you're gonna flex the knee to extend. So I'm gonna take my outer hand and flex your knee, and then I'm gonna take this hand. All right. This, So I would take this hand on the lateral side of the knee, then I would flex your foot inward. Does that hurt? Okay. And that is the valgus stress test. And for the varus stress test. So you slightly flex your knee to like a 20-degree. And the inner hand. So I would do it this way and turn your foot outward. Turn your foot outward. You're so stiff. Maybe turn it this way. Yeah, outward. No, I was just letting you know that's what I was doing. So I hold it up under here and I turn it outward. So with the valgus test, I should have had her leg land this way, and then this way, and then turn. Take this and hold on to it. Yeah, keep your knee just straight. And then for the so for the Lackman's test, I would take and put my hand here and put this one here, and then I would kind of like put it on a 20-degree, and I would kind of like pull it up, and if there's like any clicking in or anything, that would be a ACL injury. So then I have you supine, then you're gonna flex your knee to 90 degree, and I'm gonna sit on your foot. So I would sit on your foot. And then we'll do it like in a 90. Could you sit up a little? And then I will pull. Move that. I'm gonna move the camera. Okay. So now we're gonna do the drawers test, and I have her hip in a 45-degree angle. I'm sitting on her foot, and I'm gonna take my hand and put it up under the faucets, and I'm gonna go ahead and jerk. And if it was positive, then the tibula would cause her some pain on that side, and that would be a sign of another injury, ACL injury. What else do I need to do? Okay, so now we're going to do the McMurray's test. In order to perform the McMurray's test, the patient lays supine. I will take her leg and flex it. I will take my proximal hand and I'll put it on her knee line. I'll take my distal hand and put it under her heel. And so I would passively push up. And if I would hear any popping, any clicking, that would be positive for meniscus tear. So, and this is for the lateral. So if I want to do the medial, then I would go ahead and do the same thing, but I would take her foot and I would turn it inward this way and just go ahead and add some pressure. And that would be for a positive McMurray's test. And moving on, we're going to do the hip. So with the hip test, we're going to have the patient just lay straight with her legs together. And I'm going to stand on her right hand side, and then I'm supposed to move over to her left side. And I'm looking for swelling, nodules, uh, tenderness, pain, and alignment. So I'm going to do, we're going to flex her knee to a 45-degree internal and external rotation with each leg. So we'll do a 45-degree, and then we'll do an internal. This is internal, and then external rotation. And we will do that with both legs. Internal, external. So we're going to do an active and a passive flexion of the hip. So that would be the flexion. It's this way. And then the extension. And if there would be any pain, any clicking of the joint, then that would be a sign of her hip, of a hip fracture. And we're going to abduct her hip. So you roll on your side, you can roll that way. And you would straight, keep your legs straight. Keep raise one leg up to like a 60-degree. We get it at 30 degrees. And then you would take one leg, keep this one straight, and bend it back. Are you on your side? So we're going to adduct this way. So together, and then we abduct, we go this way. So now I'm going to have you roll back on your back. And then we're going to look at your iliac spine. So the anterior superior. This is the front. And then they could also have you, um, so with the anterior, which is the front, and I'm just feeling to make sure both of the hips are equal. I'm going to have you roll over and see the posterior. Uh-huh. So this would be the posterior spine. And so this would be the iliac crest. And then this would be the greater trochanter. And the sacroiliac is the tailbone, which will be right here. So I'm going to have you flex your right knee. Flex your right knee against your abdomen. This way. So this flattens the normal lumbar lordosis. And that's called the Thomas test. And the Patrick's or the Faber test. Take your left, this is the left foot, and the right this time. So the Patrick Faber test, you would have the patient in leg supine. You would take this leg right here, and you would put the foot over here, letting it relax, let the ankle hang off. Can you let the ankle hang off? Okay. And then I would start to push down this way, and if it's too painful for her, then that is a sign that we could have a fracture, not a fracture, but a IS hip injury. So I'm pushing it down. Is it painful? And that this leg should be able to come down to meet this part right here. Okay, so now I have you stand up. And then I'm gonna have her stand up. I'm gonna have her turn this way, and and what I'm doing is I'm just checking out her back, how it's curved. So up here, so we're looking for like this part right here is like the thoracic vertebrae, and then it come down in a concave like an S down in this area right here. And so with that, this is like a normal shape of someone's back. And so I'm going to look at her shoulders to make sure they're symmetrical. And I'm also going to look at her iliac to make sure the hips are even. And so also we want to make sure that her skin right down in here where the dimples are, like right here. So I'm making sure one shoulder is not higher than the other because that would mean dislocation. And looking for a smooth curve in her back. And we want to make sure that that is not any lateral deviations or scoliosis. And then we have range of motion. So how far could you bend back? So you would bend over front. You bend over this way first to touch your toes. And then you would bend back the other way. See how far back you can come. And we're making sure she doesn't have any spinal injuries. Now you bend to the right, like in a 35-degree angle. So you bend this way. You're right. Yes, you're right. Okay, you bend that way, and then you bend back this way, and I should be behind you. Okay. And then you will bend back toward me for 35 to extend your back. Okay. And twist your shoulders to the right, then to the left. Uh-huh. So the inner vertebrae is like in between. It's in between the vertebrae. Like this is her vertebrae, so it will be in between those. And you can just count those down. And they shouldn't go in or be budging out too far. It shouldn't be too sunken in. And we need to put across the spine. So you do it like this. And that's the end of my video.